that we selected that clip to show is that when we were making the film and we were thinking about who we want to reach, these were the people we were meeting. They estimate that nearly 1 million people were exposed to the water at Camp Lejeune, and a fraction of them, when we first started making the film, knew about the contamination. So we had this sort of very focused, kind of narrow view of like, we know that this film will get out in the world, and inadvertently, hopefully it'll get a lot of attention, and it will inadvertently raise awareness about this specific issue to this very specific population. And over, we were hearing these questions from people. I mean, they weren't getting answers, they weren't getting help. In the time that we made the film, thanks to the effort of Jerry, who we followed, the issue got more attention, and some of those answers started it started to come to light a little bit more. But when we completed the film, we started to realize that our audience was certainly this group, but became much bigger of who we could reach, because we found that the Department of Defense is our country's largest polluter, and that there's sites like this that maybe aren't as bad as Camp Lejeune, but there's sites all over the country. So I'm sort of giving you our progression of our outreach plan mentally. So then we started to realize, wow, we could, the film really has resonance for all these other groups. And then beyond that, we started to realize that we, as the film premiered earlier this year at Tribeca, and almost immediately we were starting to connect with environmental organizations to partner with in our outreach. And they saw this potential of the film, that it was, there's a movement in this country for regulation of toxic chemicals. There's legislation that's been solved for decades about reforming how our country regulates toxic chemicals, that it's a broken system, and that there needs to be better regulation. In making the film, we addressed that a little bit, and to our delight, these organizations that have been working toward that issue really saw an opportunity to use this film, which at first we thought really had this sort of potentially maybe a narrow but important niche, that they felt that this could really push forward some of their efforts. And what they saw was also this opportunity where you're hearing an environmental message, and this message about regulatory reform from a very unexpected source, and that had a lot more, potentially was more persuasive than hearing it from an expected source. And they found that not only in the film, but in Jerry, where we have him speaking at events, that he is very persuasive. And they also found, they kind of made us aware, our partners who are like NRDC and the Environmental Working Group and Blue-Green Alliance, some of these organizations that are working toward these issues, they also saw this opportunity in the film to reach a community that they haven't had access to before. A lot of our screenings, we get a pretty large military community showing up because they're connected to the issue. Either they were a Marine or they are interested in the issue. And all of a sudden, through the film and through our discussion afterwards, because Jerry's very invested in this issue of toxic chemical reform, we're having a dialogue with a community that maybe wouldn't be folded into that dialogue. So that was sort of another unanticipated sort of opportunity. The other thing that we have with our film is there's actual, in terms of real tangible change, there's actually legislation that's pending on Capitol Hill to address the health care for the people that were exposed to the chemicals at Camp Lejeune. In the film, we feature the introduction of a bill that's actually named after Jerry's daughter that would provide health care. They would sort of set up a similar system to what they've done with Agent Orange, where they say if you were at Camp Lejeune at this specific time and you have this set of illnesses, that you get fast-tracked a little bit, and not only service people, but family members and government employees would get help. And both pieces of legislation are still active. They're still alive. We had a wonderful, our first sort of opportunity to kind of see our film in action happen in June. We were asked to screen the film on Capitol Hill by some of the sponsors of that legislation, actually on the Senate side, not on the House side. And they gave us this opportunity to screen the film, and they knew that there was going to be a vote on the legislation the week after. So they invited a lot of staffers and a lot of congressmen, and they felt that the film would be a persuasive tool to maybe bring some more sponsors on board. We showed the film, and they were clearly doing other efforts, but the following week, the legislation called the Caring for Camp Lejeune Veterans Act came up for a vote in the Senate Veterans Affairs Committee, and it passed unanimously. Obviously, we can't take full credit for that, but it was nice to be a part of that process. And for some of you who may know about the legislative process, getting a bill out of committee is extremely difficult. There's still a bill on the House side, and we're working with those folks to do something to do the same. What we're finding as well is that the film has now been traveling a lot to various festivals, and we've been getting a fair amount of press attention, and that seems to also be pushing the legislation and keeping things alive. What we've done, so that's sort of the overview of what our goals were and kind of where our progression was with our outreach. Some other concrete things, we're really sort of in the beginning of our phase. We always knew that we wanted to start in North Carolina, truly start our outreach campaign in North Carolina. And we launched it over Veterans Day weekend, actually, with a free community screening in a space very similar to the space you see in here. And many of the people who showed up to this meeting showed up to our screening and then some. And we really sort of brought it as an event that was like, we're bringing Semper Fi was Faithful home for Veterans Day weekend. And it worked out very well. We had a great turnout. We brought a panel where we had, Jerry was there, we were there. We also brought a public health expert who could speak to what the chemicals in the water, what the health effects were. And we also brought a local reporter who had been following the issue for a long period of time to help answer questions. We timed it to coincide with a health survey that the CDC is doing of the community at Camp Lejeune. They've sent out about 300,000 health surveys, and many of the people are getting these thick pieces of thick booklets of surveys and maybe don't understand it. So we were doing also a little bit of education about what those surveys were. And it worked out really, it really did work out really well for us. We felt like we knew what the audience was going to, what their questions may be, because in making the film we heard so much of that frustration, and we wanted to create an event that wasn't going to just be us talking at them, that we would be able to respond to some of those and point people in the right direction. And then we also were able to leverage the event to get more attention on a national level so that it could extend beyond just the screening in Jacksonville, North Carolina. Because it was Veterans Day weekend and we billed it as sort of bringing the film home, we pitched the story to the local AP, and actually the national AP picked it up and reported on it, and it went throughout the country, and we were able to sort of connect with Camp Lejeune veterans who are, you know, all over the country, if not the world. And so this one screening, that did enable us to sort of spread the reach of the film. You know, our plans now are to continue to target areas where former Camp Lejeune residents are, and then in the early part of next year, we're also going to start doing screenings in other communities that are affected by military contamination. We have sort of a list, and with our partners, set up screenings there. We'll have a broadcast next year and try to fold in some of our outreach efforts for a national platform. I'm trying to think what are the other, and then I guess the last thing is we have a couple of, we have another screening planned that's more of a private screening on Capitol Hill early next year. We've been asked by some of the folks that are trying to push through the legislation to set up a screening for some selected people that they feel will be able to reach. I guess that's sort of my general intro in there. Thank you.